Depression. It's a word we hear often, a state many experience, but what exactly is it? Depression is more than just feeling sad or down. It is a serious medical condition, a disorder that affects our emotions, thoughts, and behaviors. This complex illness casts a long shadow, impacting our work, relationships, and overall well-being. The World Health Organization estimates over 280 million people worldwide suffer from depression. It can affect anyone, regardless of age, gender, or background. Depression doesn't discriminate. Understanding this complex illness requires delving into the brain, exploring the interplay of chemicals, structures, and even our genes. It's not a sign of weakness, nor a character flaw. Depression is a real illness with real causes, and like any illness, it can be treated. The first step towards treatment and ultimately recovery is understanding the science behind this often misunderstood condition. Our brains rely on a complex network of communication. This communication system depends on chemicals called neurotransmitters. These messengers relay signals between nerve cells, influencing mood, sleep, appetite, and even our thoughts. When it comes to depression, three neurotransmitters take center stage: serotonin, dopamine, and norepinephrine. Serotonin is often dubbed the feel-good chemical. It plays a crucial role in mood regulation, sleep, and digestion. Dopamine, on the other hand, is linked to pleasure, motivation, and reward. Norepinephrine, often associated with the fight-or-flight response, also influences attention and focus. In individuals with depression, these neurotransmitters can become imbalanced. Levels may be too low or, in some cases, too high. This imbalance disrupts the brain's communication system, leading to the debilitating symptoms of depression. Depression doesn't just affect our mood, it can impact the very structure of our brains. Studies using brain imaging techniques like MRI have revealed significant differences in certain brain regions of individuals with depression compared to those without. The hippocampus, a seahorse-shaped structure deep within the brain, plays a crucial role in learning and memory. In depression, the hippocampus can shrink. This shrinkage affects our ability to form new memories and retrieve old ones, contributing to feelings of hopelessness and worthlessness, often associated with depression. The prefrontal cortex, located at the front of the brain, is our command center for decision-making, planning, and emotional regulation. In depression, activity in this region can diminish, leading to impaired concentration, difficulty making decisions, and a reduced ability to regulate emotions. Another area affected is the amygdala, the brain's fear center. In depression, the amygdala can become overactive, leading to heightened anxiety, fear, and a constant state of alertness even in non-threatening situations. The fire within. Inflammation and depression. Inflammation, a natural process our bodies use to fight off infection and injury, plays a surprising role in depression. While we typically associate inflammation with physical ailments, scientists have discovered a strong link between chronic, low-grade inflammation and depression. This inflammation isn't the kind we feel as pain or swelling. It's a silent fire within, affecting the brain and disrupting its delicate balance. This inflammation can stem from various factors, including chronic stress, poor diet, lack of exercise, and even infections. Studies have shown that individuals with depression often have higher levels of inflammatory markers in their blood compared to those without the condition. This chronic inflammation can interfere with the production and function of neurotransmitters, contributing to the development and persistence of depressive symptoms. The blueprint of ourselves, genetics and depression. While environmental factors play a significant role in depression, our genes also hold clues to this complex disorder. Research suggests that depression can run in families. Individuals with a family history of depression may be more susceptible to developing the condition themselves. However, having a genetic predisposition doesn't guarantee you'll develop depression. It simply means you may be at a higher risk. Genes interact with our environment in complex ways, and certain life events or stressors can trigger the onset of depression in those genetically predisposed. Furthermore, scientists are exploring the field of epigenetics, which studies how environmental factors can actually alter the way our genes express themselves. Epigenetic modifications can occur throughout our lives, meaning our experiences can actually influence how our genes related to depression are turned on or off. Hope on the horizon. Treatment and recovery. Despite the complex interplay of factors contributing to depression, there is hope. Depression is treatable, and effective treatments are available. Recovery is possible, and individuals can regain control of their lives. One of the most effective treatments for depression is psychotherapy, also known as talk therapy. Various approaches such as cognitive behavioral therapy and interpersonal therapy equip individuals with coping mechanisms, help reframe negative thought patterns, and improve interpersonal skills. Medications, such as antidepressants, can also play a crucial role in treatment. These medications work by rebalancing neurotransmitters in the brain, alleviating symptoms, and restoring chemical balance. In addition to therapy and medication, lifestyle modifications are essential for recovery. Regular exercise, a balanced diet, adequate sleep, and stress reduction techniques such as meditation or yoga can significantly improve mood and overall well-being. A brighter tomorrow living well with depression. Living with depression can be challenging, but it doesn't have to define you. With the right treatment, support, and self-care, individuals can manage their symptoms, live fulfilling lives, and achieve their goals. Remember, seeking help is a sign of strength, not weakness. It's essential to reach out to healthcare professionals, therapists, and support groups to receive the guidance and care you deserve. Recovery is a journey, not a destination. There may be ups and downs along the way, but with perseverance, self-compassion, and the right support system, a brighter tomorrow awaits. If this video helped you understand the science behind depression, hit the like button. It lets us know we're on the right track. Share it with someone who might need a reminder that they're not alone in this fight. And if you're new here, consider subscribing to Core Psyche. We're here to break down complex mental health topics into bite-sized, science-backed insights every week.